Last time that I checked, how many supplements are there for neuropathy? Just on Amazon, there's like dozens of different types and probably hundreds on like just everywhere around us. Most of them are just selling them like the idea of like a quick fix. And I've had patients, even on Social Security, older patients on a limited budget that, and you might have seen it too, those patients that come in and they're on a limited budget, but they come in when they spend like $200 or $300 every month on like different a bag of supplements, right? And you ask them like, why are you taking this? I'll never forget those patients. They bring their bag of supplements, and I'm like, I'm pulling supplements. I'm like, what are you taking this for? Working with neuropathy patients could be one of the most frustrating or most rewarding experiences we can ever have as providers. And I'm saying that taking under consideration that we have seen lots of autoimmune conditions, we've seen mood disorders like anxiety and depression, we've seen so many different conditions, right? When we talk about neuropathy, I always remember those patients that came in, and when I asked them what they tried and what didn't work, some of them just started crying because the experience of ongoing pain that is either sharp or stabbing or the burning sensation, right? It's for some of our patients that could be random. For some of our patients, it will keep them up at night. And for some patients that I've talked to, I've had patients, older patients, who told me that, the pain is driving them crazy. They're on the maximum amount of gabapentin. And I'll never forget this one lady that came in. She was such a nice lady, very polite. She used to be an engineer. She came to me. She was retired in her 70s. And she told me, listen, you're my last resort. Like, if you can't help me, then I'm just done because I cannot live with this pain anymore. And we know that health doesn't come from more drugs. To stimulate better health, we have to guide the patient to the appropriate strategies to start restoring their health, right? That's what they're coming to see you. That's what they're paying you for, right? So which of the following is not true about chronic inflammation? Option number 1 is chronic inflammation is important for repair of tissues. Option number 2 is chronic inflammation increases oxidative stress. Option number 3, it contributes to cardiovascular diseases. And option number 4, it can be measured with levels of CRP, ESR, and interleukin 6. And ESR, just as a reminder, it's erythrocyte sedimentation rate test. Which of the following is not true about chronic inflammation? Is it A, B, C, or D? Okay, so the correct answer is number 1, A. While inflammation, this is really important to remember, while inflammation is in the initial part of our body's response to injury, tissue damage, infection, if you have a patient with prolonged, or what we refer to as chronic inflammation, it could lead to tissue damage. An ongoing inflammation would lead to tissue destruction, while the body is trying to heal, which ultimately it just impairs the proper repair process and potentially can cause either scarring or tissue damage instead of restoration. So that's something that's really important to remember when we talk about inflammation. It does increase oxidative stress. It does contribute to cardiovascular disease. And you can measure it as a C-reactive protein, ESR, or even interleukin 6. There's not just one way to measure inflammation. There's different players when it comes to inflammation. We have to remember that clinically. Now, the good news is that there's a lot that we can help those patients. We can help guide those patients to change their physiology and function. And diet is one of the things that play a major role in how much inflammation we have in our body. So let's take a look at a visual summary of what's considered a pro-inflammatory and what's considered an anti-inflammatory diet, This is from the Journal of Nutrients. It was published in 2023. I love this picture because it's a very simple, straightforward way to look at what could trigger inflammation. So overall, a plant-based diet, or even a diet that is high in vegetables, fruits, and whole grains, let's call it Mediterranean diet, we can call it a vegetarian diet, with moderate consumption of legumes and fish, with low consumption of red meat and processed food, is known to have anti-inflammatory effect. Now, on the other side, we have the pro-inflammatory diet, which has high amounts of sugar, red meat, processed meat, different snacks that have maybe processed flour or sugar, right? And then we have low consumption of vegetables and fruits and whole grains. Unfortunately, when we look at the right side, what type of diet comes to mind when we look at these pro-inflammatory diet, right? Can you think about something, one of those diets? If you said the standard American diet, or SAD, you are right. These are the components of the standard American diet. And so many of our patients come to see us every day looking for solutions for their problems. And you might prescribe them a pill for neuropathy or for other chronic condition. And we don't think about the fact that those patients are going to go home, they're going to take this pill that's supposed to help with pain that is caused by inflammation, and they keep eating inflammatory food. They keep eating food that is high in processed chemicals. They eat food high in sugar. They eat very low amount of fruits and vegetables. So they keep flaring up that inflammation, right? So it's important for us, all of us, to understand and how we can help our patients. And you don't have to be the person that sits with them and explain to them about inflammatory diet, anti-inflammatory diet. It's okay if you don't have the time to do it. I would recommend to have two options. One is you either refer them to a functional nutrition coach, or you can even hire somebody. Like in our office, in our practice, we had somebody who was a functional nutritionist, and they would work, the physician, the nurse practitioner, or myself would do a review with a patient, write the strategies, and then we move them along to do the weekly sessions with the functional nutritional coach. So that's another option, right? But it didn't take us typically more than 5 to 10 minutes to explain to patient and say, you're eating inflammatory food, it could flare up your condition. Here's a one-page, you can even copy paste this from the study, put it on a page, give it to the patient and say, here's what I would want you to start working on to reduce and increase those anti-inflammatory foods.
So I want to show you a picture from the Journal of Pediatric and Gastroenterology and Hepatology and Nutrition. And here we can see that adipose tissue is now recognized as it secretes a variety of adipokines and cytokines, both anti-inflammatory and pro-inflammatory cytokines. Like Dr. Cohen and I, we have the pro-inflammatory red shirt and the anti-inflammatory blue shirt here. So this happens with the adipose tissues as well. But here is the kicker. This is what the research is showing. When your body starts to hold on and increase its adipose tissue, we can see on this image here that it actually will start to go into the pro-inflammatory cytokines, and it starts to increase inflammation. And some of those cytokines include the TNF-alpha, the IL-1, the IL-6, interferon neuron gamma. What the good news here is, when you are educating your patients that when they have an increase in these adipose tissues from their pro-inflammatory diets, we can start to give them protocols to decrease that adipose tissue. And what happens when you start to decrease that adipose tissue? Well, what the adipose tissue will start to do is it starts to excrete more of the energy metabolism and immunity, such as the leptin and some of the anti-inflammatory cytokines to decrease inflammation, such as the IL-10. So it's extremely important to understand that maintaining a healthy weight, choosing those anti-inflammatory foods, and providing your patients with an anti-inflammatory food list or a guideline, or having them work with a functional nutrition coach will be very beneficial for that. And then having them stay physically active. These are all important aspects that we often incorporate for our treatments with our patients. And this is important in reducing chronic inflammation. And this can help with the chronic pain, including nerve pain associated with neuropathy. But if you're interested in learning more about the root causes of metabolic dysfunction and weight gain, and how to actually identify them, and all of the specific strategies that you can use and the treatment strategies that you can use, we actually invite you to check out the Functional Weight Loss Certification Program. This is an online 8-week program. It's actually pretty short for a program, and it's going to give you all of the information that you need. You're going to have live and on-demand classes, and it's going to be focused, extremely focused on weight loss with the functional medicine approach. We're also going to talk about specific labs and then how to promote your own weight loss programs.
So we're going to finish up with a supplement because I want to give you another clinical tool you can use. So when we talk about supplements, there's a lot of nutritional lifestyle strategies, herbal strategies, which are a little bit more advanced in the program. You go into herb pharmacology and how to use herbs instead of using drugs. But for now, I want to talk about one of them, right? One of those compounds, and that's alpha-lipoic acid. Now, alpha-lipoic acid is an antioxidant. It's a organosulfur compound that occurs naturally. You can find it in nutritional yeast, spinach, broccoli, potatoes, meat organs like liver or kidney. And the alpha-lipoic acid was reported in several studies to lead to a significant improvement in neuropathy symptoms. There's one particular clinical study, it was a systemic review study that reported that alpha-lipoic acid was found to lead to reduction in total symptom score and improvement in measurable nerve conduction. There is some indication that it's not only helpful for reducing the pain, but it's also supporting the healthier function of the nerves. What are the dosage consideration? So the study reported between 600 to 800 milligrams per day. It's important to know that most studies have used 600 milligrams per day, and some studies have used a simple oral supplementation while others used intravenous. So intravenous will typically be 600 milligrams. If you're doing a simple oral supplementation, one capsule is 600 milligrams. You can do that once or twice a day. And we have seen really good results with supplementation that involve alpha-lipoic acid. If we do a combined approach where we do a functional medicine evaluation session, help them to figure out what's driving that inflammation, and then over the course of the next 3 months, they take alpha-lipoic acid at 600 milligrams once a day for a minimum of 3 months, right? While we help them to start reducing some of the inflammatory foods that they're eating, we have seen reduction of pain between 50 to 100%, right? And I'm talking about some of them are really tough cases. They're maxed up on gabapentin. They try different things. They're taking NSAIDs. They're trying everything they can. And we've sometimes see 50, 60, 70, 80% reduction in pain, right? So it's like, it depends on how much the patient is compliant. It depends on your clinical skills and your communication skills. But, one step at a time. Like when you see the patient, you might recommend like one simple supplement, right? Like alpha-lipoic acid, maybe 600 milligrams or once a day or twice a day. Over time, ideally, we would really want to sit with the patient and understand what's causing that damage, what's causing that inflammation, right? If it's caused by diabetes, then learn about what triggers diabetes, right? We teach that in the programs. So and then help them with some dietary changes. Remember, even simple strategies, add alpha lipoic acid. That's like one capsule a day. It's not even expensive. It's like you can find it's like $20 to $30. It's not very expensive, right? You can add a good supplement of omega-3s to help to mitigate some of that inflammation, right? We talked about 2 to 3 grams per day. So what we're looking for is simple strategies to help our patients during the first 3 to 6 months towards recovery, towards feeling better, while we help them to find the root causes of their disease or condition or symptom. That's why they're going to come to see you instead of keep on jumping from one doctor to another nurse practitioner to another specialist to another, and they still struggle, right?
Very useful information that's going to help a lot of patients that really didn't have any alternatives before.
Yes, absolutely. And those patients, really, some of them, we know they're researching. Last time that I checked, how many supplements are there for neuropathy? Just on Amazon, there's like dozens of different types and probably hundreds on like just everywhere around us. Most of them are just selling them like the idea of like a quick fix. And I've had patients even on Social Security, older patients on a limited budget and you might have seen it too. Those patients that come in and they're on a limited budget, but they come in when they spend like $200 or $300 every month on like a bag of supplements, right? And you ask them like, why are you taking this? I'll never forget those patients. They bring their bag of supplements, and I'm like, I'm pulling supplements. I'm like, what are you taking this for? And it says, well, I read that this is good for my neuropathy. I read that this is good for my diabetes. I read this is good for weight loss. In most cases, it's just a very low quality product. Or I've seen products that have like alpha lipoic acid and it says research-based ingredients, right? Like these flashy headlines. And there's like 80 milligrams of alpha lipoic acid, right? So it's like, come on. I mean, that's not really gonna do much, right? So it's important for us as healthcare practitioners, and that's just my own. I know that my own philosophy and also yours is that we should continuously develop our skills. We should continuously be able to offer better and better guidance to our patients, because if we won't do it, who will, right? So with that being said, I really want to thank Dr. Chill for being here, sharing his years of clinical experience with us. If you're interested in the new certification, the functional weight loss program, reach out to us. We're also going to post the link again in the chat. We get a special discount. We're taking a small group of practitioners. This is going to be a little bit more intimate learning experience. It's just 8 weeks, so it's about a couple of months. And you're going to learn a lot about metabolic dysfunction, how to restore your patient's health. And we're giving a really special discount for that program. So you can reach out to us if you're interested in more information. And I hope everybody will have a wonderful evening. Take care of yourself, and we will see you in the next class.